Paramedic Maya Johnson rushed to a traffic accident call when she encountered a man trapped inside his car. The man was severely injured and would die without immediate intervention. Maya used all her medical skills to save his life and transport him to the hospital by ambulance. She was unaware that the person she saved was Dr. Richard Blackwood, the doctor who had removed her mother from the heart surgery list 3 years ago, saying she has exceeded the age limit. The surgical risk is too high. Maya Johnson adjusted her paramedic uniform and checked her medical supplies as she began another shift with the Metropolitan Emergency Medical Services, the busiest ambulance service in the city. At 29, she had spent 6 years building her reputation as one of the most skilled and reliable paramedics in the department, known for her calm professionalism during the most chaotic medical emergencies. The job required constant readiness for life-or-death situations that could arise anywhere in the metropolitan area, from heart attacks in luxury penthouses to overdoses in abandoned buildings. Maya took pride in providing the same level of expert medical care to every patient, regardless of their circumstances, background, or ability to pay for treatment. Her partner, Jake Martinez, had worked with Maya for 3 years and trusted her medical judgment completely. Their partnership was built on mutual respect and complementary skills that made them one of the most effective emergency response teams in the service. Jake handled communications and logistics, while Maya focused on patient assessment and advanced medical interventions. The afternoon shift was typically busy with traffic accidents, workplace injuries, and medical emergencies that occurred as people went about their daily routines. Maya's training in advanced cardiac life support, trauma management, and emergency pharmacology made her capable of providing hospital-level care in the field, often making the difference between life and death for critical patients. Their first call of the day came at 3:47 p.m. Motor vehicle accident with injuries, Interstate 95 northbound, mile marker 23. Single vehicle versus concrete barrier. Possible entrapment. Maya felt the familiar surge of adrenaline that accompanied serious trauma calls, knowing that someone's survival might depend on how quickly and effectively she could respond. Jake activated the emergency lights and sirens as they navigated through afternoon traffic toward the accident scene, while Maya reviewed trauma protocols and prepared the medical equipment she would likely need for a car accident with possible entrapment. These calls were often the most challenging because vehicle damage could complicate patient access and treatment. The accident scene was worse than Maya had expected. A luxury sedan had crashed into a concrete highway barrier at high speed, crumpling the front end and trapping the driver inside the severely damaged vehicle. Steam rose from the destroyed engine compartment, and broken glass covered the roadway around the wreckage. Fire department rescue teams were already working to stabilize the vehicle and gain access to the trapped driver, while state police diverted traffic around the crash site. Maya could see through the shattered windshield that the driver was conscious but appeared to be in severe distress, probably suffering from multiple trauma injuries. Male, approximately 60 years old, appears alert but in obvious pain. Maya reported to Jake as she assessed the situation from outside the vehicle. Significant front-end damage suggests possible chest trauma, and the steering wheel deformation indicates potential internal injuries. We need to get him out of there fast. The rescue team had managed to pry open the driver's door enough for Maya to squeeze through and reach the trapped patient. She immediately began her primary assessment, checking his airway, breathing, and circulation, while looking for signs of life-threatening injuries that would require immediate intervention. "Sir, I'm Maya, a paramedic with Metropolitan EMS," she said in the calm, reassuring voice she used to help patients focus on her instructions rather than their fear and pain. "Can you tell me your name and what hurts the most right now?" The trapped driver was Dr. Richard Blackwood, though Maya didn't recognize him despite the name being familiar in a way she couldn't immediately place. He was conscious but clearly struggling with significant pain, and his vital signs indicated possible internal bleeding and cardiovascular compromise that required urgent medical attention. "My chest," Dr. Blackwood gasped, his breathing shallow and labored. "I can't breathe properly, and there's severe pain in my abdomen. I think I'm bleeding internally. His medical knowledge allowed him to provide accurate self-assessment, which helped Maya prioritize her treatment approach. Maya's examination confirmed Dr. Blackwood's concerns. His blood pressure was dropping, his pulse was rapid and weak, and physical examination revealed signs of internal trauma that could become fatal without immediate surgical intervention. She needed to stabilize him for transport while the rescue team worked to free him from the wreckage. Dr. Blackwood, I need you to stay calm while we get you out of here, Maya said as she started an IV line and began fluid resuscitation. You have some serious injuries, but I'm going to take good care of you until we get you to the hospital. Just focus on breathing slowly and let me know if anything changes. The extraction took 25 minutes of careful work by the fire department rescue team, with Maya providing continuous medical monitoring and treatment throughout the process. She administered pain medication, monitored his vital signs, and prepared him for the possibility that his condition might deteriorate rapidly during transport. Once Dr. Blackwood was freed from the vehicle and secured on Maya's stretcher, she performed a more comprehensive assessment that confirmed her initial concerns about internal bleeding and possible cardiac complications. His condition was critical but stable enough for transport if she could maintain his blood pressure and prevent shock. During the high-speed ambulance ride to Metropolitan General Hospital, Maya worked continuously to keep Dr. Blackwood stable. She administered additional fluids, monitored his cardiac rhythm, and communicated with the trauma team at the hospital to prepare them for immediate surgical intervention upon arrival. You're doing great, Dr. Blackwood, Maya reassured him as they approached the hospital. The trauma surgeons are ready for you and your vital signs are holding steady. We got you out in time and you're going to recover from this. Dr. Blackwood managed a weak smile despite his pain. Thank you, Maya. Your professionalism and skill probably saved my life today. I'll make sure the hospital administration knows how well you handled this emergency. Maya felt gratified by his appreciation, though she was already focusing on the next call that would inevitably come across their radio. Emergency medical service was about moving efficiently from one crisis to the next, providing expert care to everyone who needed help without dwelling on individual cases. The trauma team at Metropolitan General took over Dr. Blackwood's care immediately upon arrival, wheeling him directly into surgery for repair of internal injuries and stabilization of his cardiovascular system. Maya completed her patient care report and restocked her ambulance for the next emergency call. Over the following days, Maya learned through hospital communications that Dr. Blackwood had undergone successful surgery and was expected to make a full recovery. His injuries had been serious enough to be life-threatening, but the prompt medical care he received at the accident scene had prevented complications that could have been fatal. Maya felt satisfied that her skills and quick response had made the difference in Dr. Blackwood's survival, though she didn't think much more about the case until she encountered his name again in a context that triggered painful memories from 3 years earlier. The recognition came when Maya was visiting her mother's grave on the anniversary of Grace Johnson's death, a ritual that helped her process grief while honoring the woman who had raised her with such love and sacrifice. Grace had died from heart failure that might have been preventable with surgical intervention that was denied due to medical policies Maya still didn't fully understand. Grace Johnson had been 68 years old when her heart condition became critical enough to require surgical repair. She had been active and healthy despite her age, working part-time as a library volunteer and caring for her garden with the enthusiasm that had characterized her entire life. The heart problems had developed suddenly and progressed rapidly. Maya had accompanied her mother to numerous medical appointments as her condition worsened, seeking treatment options that might restore Grace's health and extend her life. The cardiologist had recommended surgical intervention as the best option for addressing the structural problems causing Grace's heart failure. Dr. Richard Blackwood had been the cardiac surgeon consulted about Grace's case, and Maya now remembered their meeting in his office 3 years earlier. He had reviewed Grace's medical records and test results before explaining that surgical intervention was not recommended due to her age and the associated risks. Mrs. Johnson has exceeded the age limit for this type of surgery, Dr. Blackwood had explained in his professional but detached manner. The surgical risk is too high given her age, and the likelihood of successful outcome is not sufficient to justify the procedure. We recommend managing her condition medically rather than surgically. Maya had questioned the decision, asking about alternative approaches or second opinions, but Dr. Blackwood had been firm about his assessment. Hospital policies supported age-based restrictions on high-risk procedures, and Grace's case didn't meet the criteria for exceptions to those guidelines. Grace had died 4 months later from complications of congestive heart failure, her condition deteriorating gradually as medical management proved insufficient to address the underlying structural problems. Maya had always wondered whether surgical intervention might have given her mother additional years of life, but she had accepted the medical opinion that surgery was too risky. Now, realizing that she had saved the life of the same doctor who had denied her mother potentially life-saving surgery, created a complex emotional situation that Maya struggled to process. The irony was overwhelming that her medical skills had preserved the life of someone whose medical decisions had contributed to her mother's death. Maya found herself reviewing the events of both cases, comparing Dr. Blackwood's treatment at the accident scene with her mother's experience in his office. She had provided immediate, aggressive medical intervention to save Dr. Blackwood's life, while he had chosen conservative management that allowed Grace's condition to worsen until intervention was no longer possible. The contrast between approaches reflected different medical philosophies about risk, age, and the value of life that Maya had not fully considered before finding herself in this situation. Her paramedic training emphasized doing everything possible to preserve life, while Doc Blackwood's surgical practice apparently involved careful risk assessment that could exclude some patients from treatment. Maya discussed her ethical dilemma with Jake during their next shift together, explaining the connection between Dr. Blackwood and her mother without revealing identifying details. She needed perspective on how to process the discovery that she had saved someone whose decisions had affected her family so significantly. "You did exactly what you were trained to do," Jake told her after listening to her concerns. "Your job is to provide the best possible medical care to every patient, regardless of who they are or what they might have done in the past. That's what makes you a great paramedic." Jake's perspective helped Maya understand that her professional ethics required treating all patients with equal dedication, even when personal feelings might suggest otherwise. The integrity of emergency medical service depended on providers who could separate their personal experiences from their professional responsibilities. Maya also realized that her response to Dr. Blackwood's emergency had demonstrated the values her mother had instilled in her about helping others regardless of personal cost or benefit. Grace would have been proud that her daughter had saved a life, even if that person had made decisions that affected their family negatively. Over the following months, Maya continued to encounter Dr. Blackwood's name in hospital communications and medical conference announcements. He had apparently made a full recovery from his accident injuries and returned to his surgical practice, though Maya had no direct contact with him during her regular hospital visits. The experience had taught Maya important lessons about forgiveness, professional ethics, and the complexity of medical decision-making that she carried forward in her emergency medical career. She understood that doctors like Doc Blackwood faced difficult choices about resource allocation and risk management that didn't always align with family preferences for aggressive treatment. Maya also developed a deeper appreciation for her role in the medical system, as someone who provided immediate, life-saving intervention without the burden of long-term risk assessment or resource management. Her job was to preserve life in the moment, while physicians like Dr. Blackwood had to consider broader implications of treatment decisions. 2 years after the accident, Maya was promoted to senior paramedic and began training new emergency medical technicians in advanced life support techniques. She often used her experience with challenging cases to illustrate the importance of maintaining professional standards regardless of personal feelings about individual patients. "Every patient deserves your best effort," Maya would tell her trainees during scenario-based exercises. "You might not like them, you might not understand their choices, you might even have personal reasons to feel differently about them, but your job is to save lives. That's what being a professional means." Maya never revealed to Dr. Blackwood that she was the paramedic who had saved his life at the accident scene, just as she never discussed her mother's case with him during their brief interactions at the hospital. The secret remained a private testament to her ability to transcend personal grief in service of her professional values. The experience had transformed Maya's understanding of medical ethics and her role in the healthcare system, helping her develop a more nuanced appreciation for the different responsibilities carried by various medical professionals. She had learned that healing could come not through confrontation or explanation, but through consistent dedication to the principles that guided her work. Maya's story became an inspiration to other emergency medical professionals who learned about her background and her approach to challenging ethical situations. Her example demonstrated that the highest form of medical professionalism sometimes involved saving the lives of those whose decisions had caused personal pain and finding peace in the knowledge that preserving life was always the right choice. Sometimes the greatest victories over loss were achieved not through seeking justice or explanation, but through becoming the kind of person who could save any life that needed saving, regardless of personal history, and finding meaning in the knowledge that every life preserved honored the memory of those who had been lost.